So we've talked about root words, suffixes, and prefixes. Now we'll talk about some of the common abbreviations that we see in medical orders and medical records. AC, before meals, as in taking a medicine before a patient eats. BID means twice daily, as in a patient takes a medication twice a day. BP is short for blood pressure. Blood pressure is recorded as a part of the patient's vital signs and physical examination. BPM, beats per minute. The heart beats so many beats per minute. When you're taking a pulse, you're counting the heart's beats per minute. Cns, Culture and Sensitivity, is performed to detect whether the patient has an infection. CO, complaint of. The patient has expressed concern about a particular condition or issue that they have going on. CVA, commonly known as stroke, but CVA stands for cerebral vascular accident. DM, Diabetes Mellitus, also commonly called diabetes, or patients will say, I have sugar. DVT stands for deep venous thrombosis, which is a blood clot in the large vein. You may sometimes see the abbreviation GTT, which stands for drops. And H&H is a hemoglobin and hematocrit. It is a test done to determine the patient's hematocrit and their hemoglobin level. HS, at bedtime, as in a patient takes a particular medication at bedtime. IND, Incision and Drain, is a procedure that is done if the patient has possibly an infection. Am Intramuscular. This is a typical notation when noting or ordering an injection, also known as a shot, given into a muscle, such as immunizations are often given in the muscle of the arm. LLQ, lower left quadrant. You will note the lower left quadrant when you're doing an abdominal exam. LUQ, left upper quadrant. The spleen is located in the left upper quadrant of the abdomen.